So, welcome back to Your Anxious Child 5-Minute Solutions and Interviews with Experts. Today, I'm pretty excited to be talking with Paul Depompo and Cassandra Moore about their new book, Tics, A Child's Guide to Defeating Tics. This is a wonderful book that lays out in a sequential fashion how you can begin to help your child with Tourette's and also chronic persistent tics. And it's a neglected topic, I think. It does not always get the attention it deserves. So thank you, Paul and Cassandra, for talking with me today. And perhaps you could just, tell me a little bit about yourselves for our audience. How about
Well,
you, Paul, or Cassandra? Right.
okay, I'll take it first. So yeah, I'm Cassandra, and I'm a licensed marital and family therapist. And actually, Dr. Depompo, I'm so pleased, has been mentoring me throughout my career. And I started off working with children and adolescents in a community setting, mental health setting for a very long time, where I learned PCIT and became certified in it. So learned a lot about how to work with children with behavioral difficulties and ADHD, and then as I've grown in my career and over time, I've come to really feel passionate about working with kids with anxiety as well. And through that work with anxious kids, I've learned a lot about now working with tics and Tourette disorder, because as you'll come to understand in this conversation, there's obviously a lot of overlap, but we see those two together. And so now I work in private practice in Newport Beach with Dr. Depompo.
And yeah, my name is Paul Depompo. I'm a clinical psychologist in Newport Beach, California, the director of the Cognitive Behavioral Therapy Institute. It's in Newport Beach, and where we serve children and their families. And very passionate about work with tics and Tourette syndrome. When I was a kid, I had tics and OCD, and coming from a family, like Italian family off the boat, I was just, the diagnosis was annoying and crazy. But as I developed to become a clinical psychologist, I became very passionate about working with young people, and especially working with their parents, because it's just so key. So, we're trained in space and peers and PCIT and all the good stuff to support these young kids.
Perhaps you could help orient our audience in terms of what is Tourette's and what are some of the variations on terms of motor tics, and tell us a little bit about the prevalence of this condition.
You want to talk about the prevalence, Cassandra, and I'll talk about, because I'll start by saying what Tourette's is. Tourette's is a neurological condition, and it's made up of motor tics and a vocal tic happening at the same time and lasting a year. But so many kids just have tics, and it doesn't always turn into Tourette's.
Right. And so if you don't have vocal and motor tics at the same time, then we call it like a tic disorder if it lasts longer than a year. And you can have simple vocal tics that might be like the most common one, like kind of like a throat clearing sound. I have a lot of clients that have chirping sounds, little noises that can be made, or it can be also words that are said or repeated. And then there's also motor tics, simple motor tics like shoulder shrugging, eye blinking are very common ones, neck jerking, or there's also what are called complex tics, which involve more than one muscle group, or can be also a combination of vocal and motor tics at the same time. And those ones can be sometimes a little bit more debilitating for the clients that we see. And the prevalence is actually recently, the latest data that came out said about 1 in 50 kids will experience Tourette or have Tourette or tic disorders. But we know that tics are very common in childhood. 1 in 5 kids will have tics, but they may not persist into Tourette or a tic disorder.
Yeah, it's interesting. I did a search in my pediatric practice where I work, which has a population of about 10,000, and I came up with 100 cases of children in the practice who had been diagnosed with Tourette's.
Yeah, half of them are not diagnosed, with it. So it's, I think everybody, everyone knows somebody, right, who who maybe has the eye blink or the throat clear, but we just see it as like part of them, or we say, oh, it's nerves or something like that. They're just nervous, but it's a tic. Yeah.
What are some of the then challenges in terms of diagnosing children with tics and Tourette's?
Challenges. Sometimes there's some, like for example, 35 percent of the kids that have Tourette's also have ASD, right? Autistic spectrum disorder. But sometimes it's stimming, sometimes it's not a tic, it's a stimming. So that could be like an important differential. But CBIT, like our approach has shown to be effective on the stimming as well. It's just, has to do a lot with harnessing the child's motivation in each case.
Mm-hmm.
Did you want to talk
So,
any? Yeah.
Um,
Yeah.
So, what can you tell us about kind of the onset of, Tourette's and kind of tics, and what can people kind of expect across the lifespan?
Yeah, I mean, the onset for tics is generally typically around 5 to 7 years old. And typically it starts with like simple motor tics, such as like a head or neck roll or eye blinking, and then can develop into, more complex or more frequent ticking. The typical tics do wax and wane. So that means you're going to have periods where you have quite a few tics, or it may be one tic that's just happening at a high intensity, and then periods where they're a little bit, calm, and maybe you don't even see any. But we do find too is that the peak severity is generally around the age from 8 to 12 years old. And that actually the progression over time into adulthood is about 1/3 of children and adolescents into adulthood will actually have full resolution, so no tics into adulthood, whereas 1/3 will have less severe tics or severity of their Tourette syndrome, and then 1/3 will have ongoing tics into adulthood that could be debilitating or impairing.
And let me just add something and get your guys' thoughts on this too. It's a double-edged sword. The tics are coming out at an age when a long time ago kids were not as forgiving as they are now. So young kids have less motivation to treat it, but then by the time it gets up to middle school, where they're caring more about what their peers think and maybe their peers aren't as forgiving, like it already get other issues, like it can shape their social issues and self-esteem issues and things like that. So it's a kind of a double-edged sword. I'm glad that they're not getting the level of bullying that I did, but but it would be great to get them in earlier because it could shape their adolescent experience.
And I've also, found it's actually sort of reassuring for the child in middle school to know that they're in the kind of peak severity of the kind of tics. It's, it doesn't solve anything, but it is for many children reassuring.
Mm-hmm.
Yes. It's normalizing, because I have
Right.
had so many of my clients I work with just terrified that is it gonna be like this forever? How can I go into, high school and beyond and hearing and understanding the progression has kind of given a lot of my clients like an opportunity to take a deep breath, have some relief, and helps them actually to then feel more motivated too, to be like, okay, let's do this because there is hope.
Mm-hmm.
So tell us about CBIT and what can people reasonably expect from this program? Tell us about it.
Well, the research on CBIT is that it's 50% effective, but from our experience, that has a lot to do with how you're managing the co-occurring diagnoses that might be there, and the training and experience also of the provider. Because they say tics are the tip of the iceberg, and there's ADHD, anxiety, learning issues, ASD, like all these things could commingle with the CBIT work, and they have to be managed when they're there at the same time. And I'll just tell you really briefly, like 4 main steps is kids would come in, orient them, get the motivation going. We would get them to list out all their tics, part 1. Number 2, they learn how to dial it down, because there's things in the environment that either dial it up or dial it down. So they learn to do that, sort of weaken the enemy before we come in, on the attack. And then the 3rd step is getting really aware of it. Like, what are the moves of your tic? can you catch your tick coming? Because we get super excited once the kids catch their tick coming, because then we know we can get a really good battle line going, you know, and we can do that habit reversal. Because usually a long time ago, it was just habit reversal where you would hold your body a certain way, and then that would stop the tick from that repetitive pattern over time. But if they can catch the tick coming, they can get a really good battle line. We teach them how to hold it and how long to hold it, and then rinse and repeat. And through that process, you it's like this. It's like the CTSC circuits in the brain are firing out these tics to the child, and the child's basically firing back with their habit reversal point of the battle line. Does that make sense, Cassandra?
Yeah, absolutely. And I want to mention that when we're unfolding, like with CBIT, one thing that I think is really critical that's different, you know, that makes it not suppressing or just holding in your all your tics, is we pick one at a time. And we typically really work with the child or adolescent, or, you know, on what is the tic that's bothering you the most, that's giving you the most hassle in your life, or that's been around the longest that you just want to send to see, you know. And then we really target one tic at a time, and we unfold these steps very slowly, because we find is that we want them to really not just to, you know, check the boxes, oh, I did the treatment, really feel what it's like to hold the battle line, to notice the tic, and be, you know, outsmart the enemy in a sense. Like, we want the child to walk away from this process really being the expert on this tic. When, where, what inside me, what outside of me triggers it, and what can I do when I feel that urge to do it, that, you know, what move can I hold that's really going to block it, but also, you know, feels like I can do this anywhere and anytime.
So let's back up for a second here, because there are a couple of things I think that are important to kind of emphasize about your book. You know, first of all, in the beginning kind of phase of the book, you talk about that we need to take some time to do each of the initial phases. So, for example, you talk about taking 2 days at least to observe the tics and how they might show up. And what if we could just kind of, you know, amplify that a little bit? Because, you know, with so many kind of anxiety disorders and the like, people can make the mistake of getting caught up in the urgency of the situation and the urgency to do something. And you have provided a kind of a helpful reminder to, wait a minute, folks, we have this program, but slow down. We need to take some time to set the foundation.
I agree. It might seem like it's going slow, but even when you go slow, it goes fast. Do you know what I mean? Because sooner, you know, as long as you take your time, before you know it, you're creating those battle lines and learning to catch it coming. So you're right, absolutely right. Like patience. Patience is important.
Yeah.
Do you want to go?
I would just add to, because so a lot of times when a client comes, you know, a child comes to us, their parents are bringing them, and they're really excited, you know, like, okay, this, you know, I see my child ticking. They're concerned for their social well-being. How is this going to affect them, you know, on their self-esteem and how they view
sometimes, you know what, sometimes embarrassed, right?
Yeah,
Which
absolutely.
Yeah, we have to manage that too, right?
Right.
Yeah.
And so there's this urgency to, like, okay, let's get all the tics under control right away. And so we really want to slow our, you know, the families down that we work with, for them to really, you know, be like, understand that we want the child, number one, to be in the driver's seat. Then we call them the captain of the ship, you know, and that the parents, the co-captain, they're going to be supporting the child's decisions throughout the treatment, as well as the work that they put in. So the child's choosing the tic. And we then, you know, through that first initial meeting, are going to be really helping the parent to pivot into the co-captain role, which is sometimes very uncomfortable for parents, and then help the child identify the tic. And then once we've identified that tic, we are going to do what you mentioned, which is take 2 days to track when and where and who and what responses this tic gets throughout these 2 days, because we want to know what environmentally triggers the tic, as well as what internally triggers the tic. We want to figure out the why. So Dr. Depompo came up with like the 5 W's, you know, from school, that a lot of kids really understand, and adolescents too. Remember, like, who, what, when, where, why. And we have parents and as the co-captain, as well as the child, take these 2 days to figure out those 5 W's.
And just so you can know,
hold on, guys.
Yeah.
Hold on, because I think that we just need to also pause to talk about some of the preconditions before embarking on this program. And you mentioned, two. One is that the child really needs to do this, not to please their parents, but
Right.
because they want to. And as you charmingly say, if you want to please your parents, clean your room. Um, but you also say that you're not doing this alone, and that there's a critical role of, as you put it, a co-pilot or co-captain. And I wonder if we could just pause there just to emphasize those important two
Yeah,
elements to
yeah,
get things
yeah.
off to a good start.
We purposefully made the co-captain a general term because some children that we've worked with don't have like a identified parent that could support and help them through it. So a co-captain could be an occupational therapist or or an aunt, or it could be anybody who's willing to take that time and be the co-captain. And it's an intervention in itself. Like you're right there. It's an intervention for itself in that first meeting to be like, you're in the driver's seat. When kids come in, I usually say like, I ask them, have you ever seen one of those motorcycles with the sidecar? That little awkward sidecar? I'm the guy in the awkward sidecar, okay? You're the one behind the Harley, okay? So if you see it that way, and if this is something that you want to do, like I am your co-captain. And we need a parent who's willing, and we have to coach them sometimes, but willing to assume like a secondary role, and that's why we also talk about the importance of reward systems, because we've also identified that when we don't get off to a good start, when kids in other therapies don't get off to a good start, they haven't really identified good rewards with their parents and how it would be achieved. So I think when they go through the book, there should be some points. And when they're actually working on the assignments, there should be some points. And every kid wants something. So it's in no way a bribe. It's just been shown that kids need reinforcement. Like this is hard work. So when you tee up them being in the driver's seat and the parent facilitating and following through on meaningful rewards, it has a way better chance of working.
So also, as parents or others are learning this role, what are some well-intentioned but not so helpful things that adults can say to children with tics?
Stop that. Why are you doing that?
Uh-huh.
Are you okay? Are you okay?
Yeah, what's wrong?
Yeah. When I was a kid, my parents were like, thank you for not embarrassing me. I saw you were trying to hold your hands tightly together. And I was like, was I? I didn't know. So just indirectly shaming them or indirectly sending them a message that they need to suppress their tics, because we don't want kids to suppress their tics. We want to work through them.
But I would say most commonly what we see is a very loving response, right? Which is, are you okay? I have many clients who parents will say, I've been giving them shoulder massages after they have like a really big episode of shoulder, shrugs. And because they have tension there, and it's like very well-meaning, very loving. But what we find, what we've, the research has found in studying tics is it does unintentionally reinforce the tics and make them more likely to occur. So,
Okay,
those are some.
hold on. Now, that's a little counterintuitive, as is much of the treatment of anxiety. So I wonder if you could explain a little bit more about this counterintuitive, um, uh, idea of providing a shoulder massage after tic is not actually such a great idea in the big picture of things.
We could look at it from two perspectives. One, we could look at like the core of overcoming most anxiety disorders is avoidance and safety behaviors, and when parents are soothing something that when you soothe it indirect consequences, that there's more tics, that would constitute a safety behavior. So that would be something that we'd want to avoid. Also, if you look, those of you that have read Eli Libowitz's, you had a great interview with him, space treatment, you'd see that like the protective parent and the demanding parent, they're both well-intended, but they do increase anxiety and they do increase tics also.
Because tics are reinforced by our brain, learns when we get out of something that's really uncomfortable or we receive pleasure, right? Or we feel good. And so when the, brain is sending that the tick, and the parent lovingly gives the child a hug, they received a positive response, and the brain learned, oh, okay, well, I'm going to send that message again because it obviously worked to give me something that feels good. It's not conscious, of course. This is, happening outside of our awareness. And so that's why it is counterintuitive for us as parents, especially, yet it's good to have that knowledge. So now we know, what we need to do differently to not unintentionally reinforce the tics.
For parents out there that are listening to this, it could be helpful to see it as a parallel process. What we're going to be asking your child to do is going to seem counterintuitive, and this is going to seem counterintuitive. So if it's hard for you, hopefully it even adds more empathy on what your child is going to be having to do during this habit reversal process.
Yeah.
There seems to be kind of a consensus in working with phenomena such as kind of Tourette's or body-focused repetitive behaviors, that particularly for children under 10, that we need to use a reward system, that the natural kind of intrinsic motivation for children under 10, they're still developing that capacity. And I wonder if you agree, whether you could give any suggestions for how to make an effective reward system, because they often fall flat.
Mm-hmm.
Yeah. I mean, I think one of the biggest things to keep in mind with the reward system is that it has to be done with the child, that the menu, the ideas of what is rewarding, what's motivating, we cannot assume that we know, that it's like 5 minutes of, extra video games or Roblox, that we really spend time and understand too, what matters to them, and then sit down and figure out a plan for how and when they can receive these rewards. Because
specific.
We talk about it, sometimes we don't follow through on it, right? And we don't really also convey the expectations. What exactly does your child have to do, to receive this reward? So those are the key things, is like, it has to be collaborative. We have to make sure that the child knows exactly what they can do to access these rewards, and that we have to follow through on it.
And if there's therapists listening to the podcast now, I would suggest that this is part of the first 5 minutes of the check-in, of check on the reward system, because most of the time parents will drop off on it, because parents are busy.
Yeah.
They'll drop off. So just make that as part of your check-in and problem solve, because it's not a waste of time. And like you were saying before, people are anxious to get to when I do talks, parents are always like, what's the competing response? Like, what's that battle line? It's like, whoa, like, wait, let's slow down. You know what I mean? We'll get there. So, and don't worry. Sometimes, the tortoise wins on this stuff. But one kind of reward that I love, and I think is so great, is the natural reward. So for example, when you're doing a functional analysis and seeing what dials the tick up and down, I had a case recently where we realized that watching movies with the family were the really high tick time. So when we did our functional analysis, we saw the child only gets movies on the weekend, and that's the majority of the time they spend family time together. So the excitement is drifting it up, right? And then in addition, when he is ticking, they're both like concerned and asking him about it. So the natural reward here was, let's do some TV time with the family, like for 30 minutes every night, instead of binging, on the weekend, and let's ignore the tics until we get to the place that the parents could praise the child for using their battle line and doing the work. It's better to praise the work being done than the tick happening or not happening. So I love those rewards, like extra screen time, because that's when your tics come, and that's when you get to work on your CBIT homework. I love the natural ones. Those are the longer, like, awesome ones.
I thought you also gave a suggestion for perhaps capturing the attention of children with attentional issues, which, as we know, is a highly comorbid diagnosis. And your suggestion was, I believe, about as a reward, ice cream for breakfast. And I thought that was a great suggestion, because it would really grab the attention of, I think, any child.
Mm-hmm. Yeah, I mean, with 60, what is it, like something like 63% of these kids have ADHD. So you've got to get pretty creative to get their get their attention. Now, I would rather my child have ice cream for breakfast once a week for earning their things than to, have their tics. So I think that was great. I agree.
So after people have, kind of parted out their tics and perhaps used videotapes to kind of use that and enlisted the co-captains perhaps to analyze the tics, the next kind of phase, I believe, is trying to identify the what you call the premonitory urges that come before. And I wonder if you could talk a little bit about premonitory urges and how important that is in this process.
Well, if I think it's cool to think about it this way, like asking your child, if I was to give you $100 for you to be able to raise your hand right before you do that eye blink or that shoulder shrug, if you were going to get $100 right there, would you be able to do it? And most children would be like, yeah. And that's the start of us figuring out what this urge is.
Yeah, because 90% of individuals with tics report having some type of sensational experience, whether it's an itching, a pain, a tension in a part of their body that right before they do the tic. And because of that, that means that if we can catch it, then we can block it, right? So we spend a lot of time on this piece of the therapy called awareness training, which involves describing the tic, so knowing exactly where it happens, how it moves, the first step, second step, third step, but then detecting it, not just when it's happening, but right before, when we feel that sensation in their body.
I thought you actually gave some good suggestions about for children who may have difficulty identifying those urges, because the capacity, after all, for interoception or being able to identify the sensations coming from your body is also one that's developing across time. And you gave a suggestion also of what feels different after you've completed the tic, or how are things different, which I thought was a nice addition to for children who may have difficulty with this process.
Yeah, because the urge, you're right, because the urge is well intended. The tic is well intended in that it's trying to satisfy that urge. So some kids with an eye tic might say there's a pressure inside my eye. So when I do the blink, it sort of scratches that itch and that pressure that's under there. So, okay, so if we say, yeah, like what feels better about that blink? And then they say, well, that feeling, it soothes the bottom of my eye. Oh, it soothes the bottom of your eye. So the bottom of your eye feels how before you, so then we can back it up, which is nice.
What are some other words that people would use to describe a premonitory urge or that kind of urge before a tic?
Like an itch, a tingle, pressure?
A tingle.
Pressure, yeah. And sometimes, I think, I don't know if you get this too, Dr. Depompo, but like it's like my brain's telling me to do it. We would love more than that, but it's sometimes that's what we get, like it's the description of like I have to feeling an urgency. But we really try to isolate to where in your body, is it in your brain? And I want to mention that sometimes you might have an eye blinking tic, but you feel it somewhere else. Very commonly with eye blinking, we feel the premonitory urge is around that area, but sometimes it's in the chest, or other parts of the body, or even in the stomach. And it's not necessarily the shoulders, even though that's the tic. So it's important for that to be kept in mind too, when we're searching for this urge.
Side note to add on what you're saying, I like what you're saying, Cassandra, about like don't accept the vagueness, because some therapists might or parents might accept the vagueness of it. But as y'all know, with anxiety likes to keep things vague, right? Anxiety doesn't want to be held down to anything. So another great time to slow down and trust the process. A good co-captain, a good therapist is going to trust the process and trust that we can find it. We can find it. but managing it with curiosity and interest, and it could be an assignment just to find it.
So then the next kind of phase is developing a competing response. And I wonder if you could talk a little bit about that and why, how is that different from suppressing a tic? And what would be some examples of competing responses?
Sure. Can I? All right, I'll take that one. So we want the child to be able to catch their tics at 80% of the time. So 8 out of 10, if they could catch it, that's kind of like doing so well on your SATs, you're going to succeed in college. It's like a very golden pass gate to competing response. We feel so good when they're at 80%, and 80% could be achieved most of the time through that kind of practice of tic awareness training that we describe in the book. But a good competing response is not suppression, because when you're suppressing, you're just like holding it in. It's like white knuckling something, so we don't want them to white knuckle, and we don't want them to hold it in, because you could just tic more later. Like kids often white knuckle at school and then they tic bomb at home. So what we're doing, I think of Tai Chi. I think the brain circuitry is firing out the tic. So let's just use an example of like a neck twist kind of tic, right? So it's firing this urge in the back of our neck to kind of stretch it out. I want to hear a pop, and then it'll feel right. Okay. So if I just suppress, I'm not working that muscle that the tic is kind of attacking, right? So a good example of a competing response would be something that the tic can't break through, something that is less obvious than the tic itself, and something that you can hold for at least a minute, plus when that urge and tingle is gone. So to cut to the chase, one example would be, well, what's going to make you not do this? That's not going to be suppressing. We need to take that muscle and use it different. So maybe you're going to tuck your chin in a little bit and make it like the back of your neck is going up. Some parents out there might have like In Sync, Baby Bye Bye Bye, but if you look at the Baby Bye 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 video, they're all marionette puppets, right? So if you picture elongating your neck, tucking your chin in, and feeling that. If you take your shoulders and you slightly pin them down, like you're holding some 15-pound weights, right? You feel the pressure down here because that elongates your neck. You tuck your chin, you feel your little marionette string going up. And that would be considered a competing response, because we're not suppressing, we're taking the pressure that's coming down from the tic, and we're now pushing against it specifically, real surgically, until we can just break that connection.
Great.
And one distinction I would add to that too, between suppression and the tic blocker, or battle line as we call it, is that we're not doing this with we're not stopping all the tics at one time. We're surgically looking at one tic at a time and coming up with a tic blocker that isolates those muscles, right? And that is a big distinction as well.
So patience, people, one at a time.
Mm-hmm.
One tic at a time.
Yes.
And
when you get good at this, though, you can do a competing response, like a good battle line, with more of a broad stroke, because as you know, like sometimes one tic often leads into another tic. So it's like a whole thing. So, if this doesn't, that's tic 1. If this doesn't stop tic 2, then we can add tic 2 to the competing response at the same time. So if my hand comes up and kind of does this as tic 2, like if I do that and then push it back like this could be like 2 tics, like a complex tic. So if I pin my elbows to my side and then do my original competing response, like I said, maybe you're like a little T-Rex style or whatever, and you're adding that, the child can still type or write or game, and we're killing like a bunch of tics at the same time. So when we have those stubborn cluster of tics, we try to do a one nice battle line.
let me sure I've got this right. There are some rules in terms of developing competing responses that parents really need to keep in mind, that it should be able to hold it for a minute or longer. It should be an opposite action, and it should be less noticeable than the tic.
Mhm.
And am I missing something else?
No, that's
Okay.
the main thing. And just pick one tick just one tick at a time. Patience, like you said. Yeah, one tick at a time.
Okay, so we've developed this awareness of the premonitory urge. We've developed some competing responses. And then we go into the real treatment part of it, where we're really doing this. Now, you allude to the fact that this first week in doing this competing responses can be, shall we say, difficult. And you're not the only person to say that that first week may be really tough and really miserable. And I wonder if you could talk about that kind of first week of doing this and how it may be difficult and what are we supposed to do other than, I don't know, bite the bullet. That might be a competing response too, I guess.
I mean, it's difficult because what we're doing when we're holding the battle line is that premonitory urge, that sensation isn't getting relieved like you were used to, right? You know, for maybe a decade you had this tic. It's been relieved by doing the tic. And so now we put this battle line in place that's trying to block it, that's blocking it, right? And so you will see a lot of times this urge maybe intensifies while you're holding the battle line for that minute or until that urge goes away. And it does, especially if the tic's been around a long time, it's not going to just the first time you use the battle line, poof, it's gone. And so what we find is a lot of people will say like the urge gets more intense, and then also, you know, it's takes maybe longer than a minute. I have to hold it for 2 minutes or even 3 before I get that relief. Yet, you know, what we do to really support our clients is come up with, you know, we practice a bunch in our sessions together, and we come up with a manageable plan on where they can do it outside of the session. But ideally, we're doing it all day. But we're planning also for times during the day where we can create what we call like tic-free zones. So times, activities that typically they're not going to be ticking while doing, so that they can get these breaks as well, so that, you know, it's still
All right, so after a little glitch, let's just continue with our kind of discussion about that first week of initiating a competing response and some of the challenges that people encounter.
Yeah, so I was explaining that because the tic, for however long that tic's been around, has been used to having this, you know, uncomfortable urge sensation, doing the tic and getting relief. When we're now incorporating a battle line, a competing response that's now blocking that tic, we're not getting that relief. And a lot of times people will say that the urge gets more intense and it gets stronger as you're holding that battle line. And so that first week, especially, is one of the most challenging times to not just do the practice, but to hold the battle line for that minute or until the urge goes away. And so what we do is we really try to come up with a plan for clients where during the week, we're looking at what activities can we incorporate into your week that we know are going to be less likely to evoke the tic, right? That you're going to have some tic-free time so that they can get some reprieve, some time where they don't have to, they're not using that battle line. They know they can have that downtime. But then also during those other times, we're practicing in our session, practicing how to hold it, how to work through those strong urges while maintaining the battle line. We're looking at, okay, what can we do when we're in class and have to hold it? What can you tell yourself? What can you imagine, using imagery to help yourself maintain it and to hold it for the duration that it needs. And then in some circumstances, ideally, we want to go throughout the whole day, right? So we're starting at the beginning of the day. We're trying to use the battle line as often as we can when we notice the urge to do the tic. But for some clients, we have had to look at, okay, well, what's a time of day where I'm really motivated to want to practice this battle line? And let's start there and get some, repetition and some reps in, and then we can extend it as we're getting more confident in our use.
And what should the co-captain's role during this kind of very important week be? How can they truly be supportive, and what are some potential pitfalls to avoid during this more challenging initial period?
Yeah, well, we don't want the parents to get into a negative cycle with the child, because we don't want the child to not like working on this. So, it's great to ask the child, we sometimes we're trying to figure this stuff out as therapists, when the best answer is to just ask the client. So how can your co-captain support you on this week? Do you want them to remind you, of when you're going to be working on it? Or would you rather just set some time on your Alexa or Google Nest to remind you? Like, what would you like from them? How would you like them to respond? And at the end of the day, we want the parent to, again, reinforce when they see the child's working on it and show that they're proud of them, and really just continue with the reward system and making sure they're getting reinforced in that way as well. And that's the most important thing. So we should ask the client, and we shouldn't think that we should see our clients as very capable, and see week one of the competing response as a draft, and letting them know, don't worry, we're going to work out the kinks this week. Play with it, experiment with it, and then let's just adjust it and we'll figure it out. And that would be a good co-captain that helps the child decrease the stress or pressure around it, try to make it something that's they're doing together, and work in progress.
Great. Well, yeah, go ahead, Cassandra.
Yeah, we also created a battle tracker that looks kind of like a game board. That I found has been really fun for kids. So we print it out, they go home with it. There's rewards for each day that they're able to tick off. They move ahead in the game board, and then there's even special spots on the game board where there's extra points that are earned, and turning it into a bit of a game where they're progressing to the ultimate, and really helps to get repetition, because we do want that daily practice as often as possible. Sure. And it makes it a little more.
Right. Well, we're almost out of time. Two things. One is, where could people learn more about your work, and where can they buy the book? And are there any kind of parting kind of comments or thoughts that you might want to share with our audience?
Anybody interested in more information, they can go to gettic.com and see the different books on tics and Tourette's that we have. One is called How I Kicked My Tics, and it's for the little kids, 5, 6, 7, 8, 9, kids that want to be oriented to CBIT, but in a very story-like palatable way to get them primed up for it. And then the second book, of course, is Tic'd, A Child's Guide to Defeating Tics. But go to gettic.com, and then you could also connect with our Instagram and follow us there, because we try to put out a lot of videos for little 1-minute learning snippets, and Also, when you sign up, we're going to be sending out really nice email letters with lots of tips and tricks on there.
Yeah, and the Instagram handle is get ticked.
Great. Well, thank you so much. This has really been kind of delightful, and I think your book is going to be very helpful to a lot of people.
Thank you so much. Thank you so much. It was great talking to you.
Yeah, it was
Good.
great.
And we're very. Did he leave? Are you there? He left.
Yep.
Bye. Okay. Thank you so much. Take care. Bye bye.